you mentioned, the communication part, and I've been fortunate that we've done a couple of sims together in anesthetics, and that was probably the first thing that actually stood out to me was your communication when we were doing the sims to, I think there was a patient and who was the mother of the patient who's completely distressed, and the way that you kind of deal with that situation, and it showed like your communication skills were through the roof, and I think that's a great thing to have in a leader. And the reason I mention that is because most of the time when you're doing resus in ED, the typical thing is that you think of someone who's a team leader in resus as someone that's maybe loud, maybe abrasive, maybe an extrovert. And those things are typically associated with gender stereotypes. Do you find any challenges being in these research situations where you're the team leader and gaining the authority of the situation, or the way you handle
Mm.
it? And what's your approach in those kind of emergency moments?
Yeah, that's a great question. I think there are definitely stereotypes that exist, and I was always really impacted by an experience quite early in my career of when I was a paramedic student. We brought in a patient that was quite crook, and the ED consultant was sitting up on the back desk, swinging his legs back and forward, looking very bored at our handover. And eventually just rolls his eyes, wiggles his way off the table, and goes, "Righto, this is what we're going to do." And it was all so hyper masculine,
Mm,
so cavalier and disrespectful almost towards the rest of the clinicians in the room. I'm a big believer that you can learn something from everyone, and that can be you get these beautiful positive role models, and you get these great negative role models of what you don't want to look like as a clinician. And so for me, that was a really useful moment of going, that's for me not what a good leader looks like. I think that there are times that we face more challenges as women or people that identify as women. And I've been very fortunate to mostly work in departments with lots of excellent female role models and consultants. So I've personally not struggled with that too much. But I know especially when I did a regional term, it was a lot more obvious to me
mm,
that my place was potentially slightly different. That's a bit more complicated, I guess, to discuss. I think the way that I approach leadership in a resuscitation situation it has been quite influenced by my paramedic background, because there's a certain way that we learn to communicate there, and I'm someone that is quite comfortable with being assertive without being forceful, and I think that's a technique that takes practice and time, and using a lot of closed loop communication. So, Arnie, I need you to go and get me 1 liter of fluid to be running stat now, please. And then I would expect you to respond that back to me. Or if you didn't say anything, I'd say, Annie, did you hear me there? Can you go and get that 1 liter of fluid? And just that sort of technique of being quite clear, having been in quite a few resus situations, where it's announcements of requests that don't get directed to people, that then just float awkwardly in the air and nothing really moves forward or gets done unless you've got really good team members that just learn to absorb these mysterious messages in the background. So I think for me, yeah, learning to be assertive without being aggressive is really useful. Being directive towards particular people, using names for me is a big thing. So if I'm ever in a resuscitation situation, I will always if I don't have my name badge on, I will write it on a piece of tape, and always trying to identify who's who and use people's names, because that makes a big difference as well. The last point I want to say is it's really helpful recognizing your limitations as well. Like there's so many resuscitation situations that I've been in where I absolutely have hit the limit of what I'm capable of, and I've to the point that I don't know what to do next. And it's just such a great opportunity as a leader to be able to either throw out to your colleagues around you and ask for other suggestions and have that shared mental model, or to call someone else for help and ask for help. I think that's a sign of a good leader, is when you know how to use all of your resources well.
that final point, I think that's the hardest point to achieve. And it's that balance of what you said with being assertive enough that people, respect is not the right word, but being assertive enough that people feel like you're in charge or have some semblance of control, but not being too assertive where they feel like they can't chip in and contribute, and
Yeah.
you don't give off this vibe of being open and willing to hear ideas. I think that's always a tightrope, and I think the
Mm,
best resources are when you have a clear leader, but that leader is able to take everyone's abilities and maximize them, because someone might have a
yeah.
skill or a thought that is absolutely crucial to the success of that research situation. You see it with some people. I think some people just have this automatic aura that you go, how can I capture that aura? Then they just walk into a room and everyone's adrenaline levels just drop and they become calm.
Mm.
And at the same time, they feel like that person's in control, but we can like talk to them, and they're going to listen and they're going to hear what we're saying, and they're going to take that on board and put all that together.
Absolutely.
I don't know. I don't know when I'll ever get to that or if I'll ever get to that, but it's just a skill that you have to just keep practicing.
Yeah, and with humility, hey, it's like watching and learning and just like constantly, that's the wonderful thing about being an intern and a resident and a student. Like you can take all those experiences and see all those role models, as I said, the positives and the negatives, and you just integrate those tiny bits into your practice over time. And maybe, yeah, between the two of us, we'll become half decent at some point.
I remember the best thing I did. One of the best things was I was working in palcare as a resi, and I always find like difficult communications are the most rewarding because you feel like
Mm,
you can get the most out of it. And weirdly enough, I get a weird satisfaction from giving people in palliation like a good, dignified death and making sure their families are okay. And I remember I was working with this consultant, absolutely lovely, and he used to say this line to the family: I want to do what's right by the patient. I want they live their life with dignity, and I want to respect that dignity." And he
yeah.
used that line with pretty much every family he met, but in a different way, and he honestly meant it. And I've just now incorporated that line in every difficult conversation I have. It's like what you're saying. You incorporate that, what you think is good, and that's how you somehow become your own consultant. And someone will hopefully see you as a role model and then take what is good from you and take what is
Yeah.
bad from you and not use it, and take what's good from you and hopefully use it.
100%. That's where that mentorship model of medicine really comes to its own. It's, formal and informal mentorship and learning from others. It's so important.
Mm.